Question number 1. A 40-year-old client underwent an exploratory laparotomy with anesthesia, an assessment of abdomen 36 hours, post-operative short, abdominal distension, and an absence of bowel sound. Which complication is most likely? Options. Option A. Paralytic ileus. B. Hemorrhage. C. Colon rupture. D. Interception. So here the correct answer is option A. Paralytic ileus. So paralytic ileus is a temporary cessation of bowel motility that can occur after abdominal surgery, especially with the use of anesthesia. Question number 2. A nurse in the neonatal intensive care unit is caring for a premature newborn who is diagnosed with respiratory distress syndrome, and the doctor ordered administering surfactant. So surfactant should be given by which of the following routes? Option A. Intravenous. B. Subcutaneous. C. Intramuscular. And D. Endotracheal. So here the correct answer is option D. Endotracheal. Surfactant is a substance that helps with lung expansion. It is administered directly into the lungs of premature infant diagnosed with respiratory distress syndrome. The appropriate route of surfactant administration is endotracheal, involving the instillation directly into the trachea through an endotracheal tube. This method allows for optimal distribution of surfactant within the lungs to improve respiratory function in preterm newborns. Question number 3. A patient at 32 weeks gestation presents to the clinic with painless vaginal bleeding. Considering her symptoms and gestational age, which condition should the nurse suspect and prepare to evaluate further? Options. Option A. Placenta previa. B. Placental abruption. C. Preterm labor. And D. Cervical insufficiency. So here the correct answer is option A. Placenta previa. So painless vaginal bleeding in the second or third trimester is a hallmark sign of placenta previa. Question number 4. A patient is admitted with water toxicity. Which of the following should the nurse expect? Options. Option A. Increased urine osmolarity. B. Decreased hematocrit. C. Decreased cardiac output. And D. Increased blood uronitrogen. So here the correct answer is option C. Decreased cardiac output. So the water toxicity occurs when there is an excessive intake of water leading to dilution of electrolytes, particularly sodium, in the bloodstream. So this dilution can disrupt the normal cellular function, including that of neurons and muscle cells, and can lead to symptoms such as confusion, seizures, and in severe cases there is an decreased cardiac output, and even coma will occur for the patient. So while the option A, B and D may occur in other conditions, they are not typically associated with water toxicity. Question number 5. A patient with 34 weeks of gestation is diagnosed with Oligohydramnios. What is the primary concern associated with this condition that the nurse should monitor for and address? Options. Option A. Preterm labor. B. Fetal growth restriction. C. Gestational diabetes. And D. Preeclampsia. So here the correct answer is option B. Fetal growth restriction. So in oligohydramnios, or low amniotic fluid is often associated with fetal growth restriction, and other complications such as cord compression also can occur. Question number 6. A nurse is administering a shot of vitamin K to 30 days old infant. Which of the following target areas is most appropriate? Options. Option A. Gluteus maximus. B. Gluteus minimus. C. Vastus lateralis. And D. Vastus medialis. So here the correct answer is option C. Vastus lateralis. So the most appropriate target area for administering a shot of vitamin K to a 30 days old infant is the vastus lateralis muscle. So this site, located on the lateral aspect of the thigh, is commonly used for intramuscular injections in infant and young children. It is due to the presence of a well-developed muscle and reduce the risk of injury to major nerves and blood vessels. Question number 7. A nurse checks the medication chart of a patient which has the following order: hydrocortisone to GTT octic every 12 hours. Which of the following medication administration route should the nurse use? Options. Option A, in the ear. B, in the eye. C, in the nose. and D under the tongue. So here the correct answer is option A, in the ear. The term GTT means drop and GTTS means drops. The term octic indicates that the medication is intended for the ear. Therefore, the nurse should administer 2 drops of hydrocortisone into the patient's ear canal. Question number 8. A patient with 36 weeks of gestation presents with severe right upper quadrant pain and elevated liver enzymes. Which condition should the nurse suspect as the most likely diagnosis requiring urgent medical intervention? Options. Option A, acute fatty liver of pregnancy. B, preeclampsia. C, HELLP syndrome. And D, cholecystitis. So here the right answer is option C, HELLP syndrome. So severe right upper quadrant pain and elevated liver enzymes are indicative of HELLP syndrome. Okay. So HELLP syndrome means that is hemolysis, elevated liver enzyme and low platelet count. Okay. So it's a severe form of preeclampsia. Question number 9. A maternity nurse is performing a newborn assessment 30 minutes after delivery of a baby who did not receive any prenatal care and has an unknown gestational age. The skin is excessively lethargic, cracked and dry. There is an absence of lanugo and vernix. How many weeks gestation is this neonate? Options. Option A, less than 30. B, 30 to 35. C, 36 to 40. And D, greater than 40. So here the correct answer is option D, greater than 40. The extensive lethargic, cracked and dry skin with the absence of lanugo and vernix suggests a post-mature or post-term neonate. These characteristics are more common in infants born after 42 weeks of gestation. Therefore, the neonate is likely to be greater than 40 weeks. Question number 10. During a non-stress test, what indicates a reactive result? Options. Option A, fetal heart rate acceleration with fetal movement. B, fetal heart rate deceleration with fetal movement. C, no changes in fetal heart rate. D, decreased fetal movement. So here the correct answer is option A, fetal heart rate acceleration with fetal movement. A reactive non-stress test is characterized by fetal heart rate accelerations with fetal movement, indicating fetal well-being. Question number 11. While a nurse is assessing the head of a newborn in the first hour after delivery, she observed a soft edema over the vertex which crosses the suture line. Which of the following would be the proper nurse's interpretation? Options. Option A, cephalohematoma. B, hydrocephaly. C, large head. And D, Caput succedaneum. So here the right answer is option D, Caput succedaneum. Caput succedaneum is a localized swelling or edema of the soft tissues of the scalp, often present at birth or shortly thereafter. It is commonly caused by pressure exerted on the head during the passage through the birth canal. Question number 12. The nurse in the emergency care unit used the Ramsay sedation scale to measure the level of sedation for a patient with head injuries and who is on mechanical ventilator. The nurse found that the patient is sleeping and showing no response to light or loud auditory stimuli. What is the level of sedation according to RSS? Options. Option A, 1, B, 3, C, 4 and D, 6. So here the right answer is option D, 6. The Ramsay sedation scale is commonly used to assess the level of sedation in patients. The scale ranges from 1 to 6 with each level indicating a different level of sedation. The level 1, anxious and agitated. Level 2, cooperative, oriented and tranquil. Level 3, response to commands only. Level 4, brisk response to light globular tap or loud auditory stimulus. Level 5, sluggish response to light globular tap or loud auditory stimulus. Level 6, no response to light globular tap or loud auditory stimulus, or deeply sedated. In the scenario described, the patient is sleeping and showing no response to light or loud auditory stimuli. This corresponds to level 6 on the Ramsay sedation scale. So, The right answer is D.